So the sponsor's role, I'm going to actually stand in the shoes of a sponsor now because I have been a sponsor. So I'm actually going to reflect on the journey of 4 people that I'm pretty close to. So for John Llewellyn and Phil James, who were both my deputies at Salford NCA Group, I was the sponsor for the academy, and so I had to provide that support, particularly for John. He did the MSc, and he needed quite a bit of sort of ad hoc support to sit down and talk about what his final sort of dissertation was going to be, and make sure that that was valuable to Salford NCA as well, and that it was in tune with what was needed. So John, who's top left, did the MSc. Phil, bottom right, did the PDip, and both of them obviously have passed. They were both cohort 1, and have both very much enjoyed the programme in terms of, its participation in the action learning sets. And in fact, John's action learning set does still meet post-programme, and he finds that very valuable. Emma, who's on the top right, she's a delirium and dementia consultant at Salford NCA Group. She was part of the cohort last year, so cohort 2. And while I wasn't her sponsor, I was her sort of line manager as part of the CCIO team while I was at Salford NCA Group, and was supporting Emma through that journey, in particular, really balancing her sort of work and the program and the time that it was taking, because it was 10 days of residentials a year and 5 to 8 hours per week. The other thing for Emma as well was looking at her job plan and talking with some of the other clinicians in her space to make sure that they had a safe service while I was operating. And then now, I don't know if it's Ian or one of the other good folk on the call who's George's sponsor, but George's was somebody that talked to me a lot before coming on the programme. And again, he is from Salford NCA, my former home. And George's is really, participating well in the programme, and is interacting really well with the organisation to make sure both he and the organisation benefits. So it's been a journey for me in that sort of sponsor and supporting role from the organisational perspective, but for me it was about making sure that the participants were able to actually go on those 10 days of residential, which are obviously virtual now, but it's still that commitment, and also that they had that space to do the 5 to 8 hours a week of learning and engaging with the programme. What's also needed is contact and supervision for your participant, including one-to-one sessions, because I think regular contact is really important. But ad hoc support is also needed. As I said with John, there was a sense of exploring what was going to be really useful to the workplace as well as what was going to be useful to him. And those conversations, I think, will benefit both the organisation and the participant. And I think it's also really important to get to know your participant or participants who are on the academy, because as they grow on the academy, you get more chance to leverage their skills. And I will give you an example of actually John's peer group again, from cohort 1. There are 7 of them or 8 of them. I can't remember. It's 7 plus John. Every one of them on that, on that peer group on that first programme have now taken on additional responsibilities or taken a promotion. And that may be coincidence, but it may well be because people have spotted the leadership skills and the confidence that these individuals have gained and enable them to actually move forward in their careers. And so in terms of being the recipient of the the Digital Academy, which is paid for nationally, so it's actually paid for fully by HEE at this point in time, it's really the recipient organisations, I would say, almost responsibility to leverage that individual and the skills they come back with to make sure that you are able to get a leadership sort of capability and transformational change. So the benefits, what are the benefits of the academy? I've got a little diagram here on the left about digital literacy and the digitally ready workforce, but we did a very interesting piece of work with HEE around the rate limiting factors for transformational change in our system. And unless we actually invest in the capacity and capability for transformational change enabled by digital, it will become the rate limiting factor in its own right for that change. And so skills are very, very important. And those skills begin in our system with boards and with the Academy participants. So that the sister program of the Academy is the Digitally Ready Board program, which is being run by HEE. And that's getting boards confident, competent to work with digital leaders in transforming the system. So the benefit really to your organisation or your locality is that you're investing in leaders capable of working with boards to implement transformational change enabled by digital. And that's something that is increasingly in demand, especially after COVID. We've all, run very hard at digital outpatients and remote consultation and all sorts of things that have enabled us. But we've realised that we can actually transform the system with technology. And so we've almost put the foot on the pedal of this transformational change agenda. And so by actually putting participants on the programme, you're creating that capability within your organisation. By the nature of having digitally ready leaders in your organisation, you're also creating the right environment for the rest of the workforce to become digitally ready as well. So the effect of actually having a digital lens, leadership-wise, is that you consider that in learning, workforce development, and that is something that really does need to be considered for the future. In the next 10 years, we will need every member of staff to be digitally ready for the systems that we present. We will have every nurse as an e-nurse. We will have this well and truly embedded within medical schools. In fact, some nations have now started setting up digital medical schools. And so really by having people on the programme, you're expediting that journey to make sure that there is a lens and a focus on digital and that you're getting your workforce ready. You're also enhancing your capability and capacity in leadership to examine technologies, look at analytics, look at future skills such as AI. So, you can have somebody there that is able to sort of triage those future things and look at when it's ready for your organisation or locality to embrace it. And you're also investing in the new registered professions of informatics and clinical informatics. Now, you may not be aware of this actually, but we have a registered body for informatics professionals called FedIP, which includes the BCS. And we also have a registered body called the Faculty of Clinical Informatics for all types of clinicians working in digital health. And as time sort of progresses, more and more people are joining those bodies. It is not mandatory at this point in time, but at some point in the future, it is likely to become the de facto standard for our professionalism. And so investing in those registered professions, again, allows you to, have a solid base of those skills to hold you well for the future. But I would encourage you to have a look at FedIP and the Faculty of Clinical Informatics, because that's very much the way in which professionalism is going within the NHS.